long week of full-time work from home, and we know you're inundated with information, so we want to thank you so much for taking the time to be here with us today. We put in a lot of work to help cut through the noise and give you facts and answers to make informed decisions. A few housekeeping items, and then I'll turn it over. First, please note that you are on mute. We still really want to hear from you, so please use the chat function on the right side of your screen to ask questions as you have them. We will keep the presentation open at the end to answer as many questions as we can, and any we don't get to, we will have a Q&A section on our site that will be updated regularly. If the video viewer is blocking your slide view, please hover over it and select the button with the arrow, and it will dog it to the video pod for you. Finally, you will be receiving a follow-up email with a link to the presentation, as well as the slides for additional resources. Please allow up to 24 hours for that email, and if you still don't receive it, please reach out to me at marketing@threadhcm.com. Okay, I think that's it for me. I'll turn it over to Lori Winters, our CEO.
Good morning, everybody. I am Lori Winters. I'm the founder and CEO of Thread, and I just want to thank everybody so much for joining us this morning. I wanted to introduce this webinar to our clients and our other invited guests that we have on here today, because this is such an important time. We have many small to mid-sized business clients, and I know many companies right now are struggling just to even keep up with what's going on. And I'm so passionate about these companies, and we're trying to do our part to help during this unprecedented time. For those of you that are our clients, please know that we're ready to support you. We have a great software partner, iSolved, that is preparing for the necessary payroll and tax-related changes that are coming. For those of you that are with other third-party payroll and HR companies, I know these companies are also preparing their software and will also be prepared for you as well. We're all in this together as an industry. We are preparing to continue these webinars and Q&A sessions as new information becomes available, and it's becoming available every day, as you all know. And we will let you know at the end how to get access to all of that. Next Tuesday, we're going to have an extremely talented employment attorney that's going to help deliver some valuable content as well. And at the rate you pay nowadays for this type of help, I would definitely tune in, because that's going to be free. And so without further ado, I want to introduce the leader of my HR outsourcing division, Scott Massley. Scott has 25 years in the HR business. He has all the letters following his name, including certified SPHR. And even though he has 2 degrees from the University of Georgia and I'm a Georgia Tech alumni, I still think he's pretty awesome. So anyway, he's a very talented leader, but also an extremely compassionate one. He's been working long hours supporting our HR clients during this chaotic time, and also trying to keep updated on all the changes out there. So Scott, I'm going to now turn this over to you.
Thanks, Lori. I appreciate it. I know everybody has got their pen and pad out ready to take notes, so I'm going to give you as much information as I can. I promise I will not make you stare at this face for longer than a few more seconds. I just want to say hello and let you see who you're listening to. I'm really excited to be a part of Thread here. We got a great, incredible, practical, productive, compassionate team and a leader with a lot of integrity, and that's why I'm glad I'm here. So we're going to give you everything we can. If you have any question that comes up during this presentation, feel free to type it in. If we don't get through it during the presentation or at the end of the presentation, that's why we're continuing to schedule calls with attorneys and with ourselves so that we can just keep giving you answers and guidance as we get it. So let's get started. Stick with me. So today we're going to talk a little bit about what you can do as a business. We're going to explain the Families First Act and some of the issues around that. Talk about the questions we're getting surrounding quarantine, self-quarantine, government-mandated quarantine, involuntary quarantine, all that kind of stuff. And then a lot of questions we've received about time and money. Can we reduce time? How do we pay people? What do we do with vacation? Those kind of things. What if we don't have vacation? And then other questions that we've received as people have registered. We really appreciate y'all signing up for this and giving us a chance to help you today. We've tried to squeeze in as many questions as we could to the presentation, and that's where some of those slides get to. We've got about 51 slides today, so we're going to get to it. First thing we're going to talk about is what to do. First thing you should do is think about following the CDC guidance and other guidance that's out there, but the CDC is the best site to start with in terms of the illness-related issues. You know, what should you do in the workplace if you have someone who's ill, if someone has a family member who's ill, if you have people who are traveling, if you have an issue in your workplace, all of those things are addressed clearly on the CDC website. So definitely go to that. And you should also be thinking about contingency planning in terms of, now it may be too late for you to say we're going to scramble and put together a big emergency plan that we did not have before this took place. I think a lot of companies are wishing they did, and you're not alone if you have that thought, but it is time to start thinking about, okay, what should we do when we have employees who need to work from home? Simple things like, do we have everyone's personal email? Have we gotten people who are getting live checks to go on direct deposit or use pay cards if possible in case there's anything with courier systems, right? Do you have the technology for people to work from home? Do you have the security in your IT system? Do you have a good way to communicate with all your employees and do video meetings or conference calls? All those simple things that you need to test now in case they're coming if you haven't started those already. And then we're going to dig into more detail about all of these things, so don't worry. And then we're going to talk about, you need to think about who's eligible for the emergency paid leave. We'll explain that. And then what's most important is that you really communicate every day and can everybody hear me? I see a few comments that folks are saying that they can hear the audio. It's showing that it's on for me, so I'm going to keep going. Okay, good. People are saying they can hear me fine. Sounds great. Appreciate it. So we'll keep going. Communicating is really important, and being transparent is really important. So I know that sometimes I've heard from leaders who are saying, I want to get everybody's morale up and make sure they're not scared and cheer them up. And we all feel that same way. We all are pretty optimistic that we're going to get through this, and maybe it will make us stronger. And it's a good opportunity for us to develop as a team and test ourselves and really dig in. So look at it that way and just communicate as transparently as you possible, as often as possible with your employees about what's going on, what's happening, what the expectations are. And then if you have questions, don't be afraid to say to your employees, I don't know the answer to that, but I'm looking into it and I will follow up as soon as I can. And that's one of the reasons we're doing this today, is so we can provide some of those answers. Now, when you think about your workplace, one of the questions we've got is what can we do in our workplace? So just some basics. Think HR recommends you stop handshaking, have employees wash their hands as much as possible, schedule hand washing reminders. You hang posters around the office. They have multi-language posters about hand washing and personal hygiene. Make sure you're disinfecting your doorknobs and handrails and things that people touch all the time, their mouse and their keyboard and phones. Make sure you're limiting travel if you can do that, so people aren't having more exposure than they need to have. Limiting exposure to large groups as well. I know my 17-year-old daughter likes to go to every concert that comes to Atlanta, so I had to shut her down on that recently, and that's just the way it goes. So set up your video conferencing and all those things. And then another comment I heard was to eliminate shared food. So if you have bowls of candy or boxes of donuts and things like that out, you might want to think about putting that on a temporary hold so people aren't just passing along germs by reaching their hands in there. So think about basic impacts you're going to have to business. All of these things are possible. I hope you're not experiencing all of these, but the good chance that almost everyone on this call is experiencing some of these. And we're going to talk mostly about some of the legislation today, how you manage your employees and how you pay them, and things you should and should not do in terms of best practices, because there's more than just what's legally required. It's not just what do we have to do, but it's also what should we do. And as a business leader, you should always be thinking about both those things, right? There's the law, and then there's also what's right for you and your employees and your business. And you've got to consider all of that, not just one or the other in a bubble. Biggest question right here is the fear of, what if our business dips down so low that we can't afford to pay our people? What if we can't even make payroll? Well, number one, I would say just make sure you talk to your employment attorney, not your real estate attorney or any other kind of attorney, but your employment attorney, about the best course of action, because different states will have different rules about this. Also, you want to notify your payroll partner. For instance, like if you're doing payroll with us, you want to notify us so we're on the same page and we can work together to help you through it. And then also the Small Business Administration is setting up an economic injury disaster loan program that is going to provide working capital loans up to $2 million if you qualify. And they're working with governors to set up low interest loans to small businesses that have been really hit, like restaurants and bars and industries that are really being affected by this. But if you want more information about that, just go to sba.gov/disaster. I've heard information about banks working together to, help businesses as well. I've heard about tax deferments possibly and that kind of stuff, but it's too soon to really share information about that because we don't have details and it's not concrete. So I'm not going to be able to comment on those things specifically today. So I know you're interested to hear about the legislation, so let's talk about that. Families First Coronavirus Response Act. I'm just going to refer to it as Families First, or the Act, while we're talking today. The design of this is several things. One of the things is it addresses free testing for the coronavirus, and that's a good thing. It also addresses paid sick leave and family leave, and we're going to get into that, but it's designed specifically to apply to employers under 500 employees. So there's no obligation for companies that have over 500 employees. I know people are upset about that. The expectation that I've read is that companies over 500 employees are expected to voluntarily provide paid leave, but they're not required to yet. I don't know if that's coming or not, but for now, we're only talking about companies under 500 employees, okay? And it's emergency paid sick leave and job protected family leave, expanding the normal FMLA leave, and we will explain. And there are pay caps associated with both of those and each kind of leave. And then there are tax credits that will supposed to cover 100% of what you're spending to comply with these requirements under this act. So what is the FMLA part, right? So we're calling it an FMLA expansion. Again, it's for businesses under 500 employees, and it is only for people who have to stay home, who are unable to work, and it's all of these criteria, not just one or some of them, it's all of these. So it's for businesses under 500 employees who are unable to work because they're taking care of their kids who are under 18 years old, because the schools are closed because of a public health emergency. And that's a lot of becauses, but that's the way it works. So if there was no public health emergency, this probably wouldn't apply. Or if the schools were open and you didn't have to take care of the kids, then this wouldn't apply, right? So to apply, you got to be in a business under 500 employees. The employees have had to work there for at least 30 calendar days. They have to be home taking care of their kids who are under 18, whose schools are closed due to a public health emergency. So all of that has to be met. There are exemptions. If you work for a company that has under 50 employees, you could claim hardship for this. That is not explained yet. I'm sure it will be. Basically, what they're saying is the Secretary of Labor will work with the Department of Labor to let governors exempt certain businesses who are basically hit pretty hard by this. But if you're under 50 and this is going to be a struggle, then just stay tuned, pay attention, and plan on applying for that if you're not able to do it. And it takes effect April 2nd this year and expires at the end of the year. So any benefits that we're talking about under the Families First Act, they expire at the end of the year. They don't roll over. I see the questions coming in. I will start hitting those in just a few minutes. All right, so the other FMLA expansion requirements. So what you have to do under that is it's 12 weeks of job protected leave, just like other FMLA leave, except the eligibility for employees is different. That's what we talked about on the last slide. And the first 2 weeks, the first 10 days are not paid under the FMLA. So if you have an employee who's eligible to use this FMLA, the first 10 days are not paid. But during those first 2 weeks, they can use the emergency sick leave, which we're going to talk about next, if it's applicable. If it's not applicable, then they could use your company PTO, vacation, sick days if you have those during those first 10 days. After the first 2 weeks, then they go on this job protected FMLA leave, which job protected, for those of you who are not familiar with that, means you can't fire people while they're on this job protected leave, unless you have extreme reasons, and I would stay away from that if they're on this job protected leave. So 10 days, the pay after the first 2 weeks is you're going to pay 2/3 of their regular rate for hours normally scheduled to work, up to $200 per day and $10 total for the full for the last 10 weeks. But then there's a total of 12 weeks job protected leave. So I hope that makes sense. It's a total of 12 weeks of job protected leave, but the first 2 weeks are unpaid, and the last 10 weeks, if they qualify for them and need them, are paid at 2/3 of their regular rate, up to a max of $200 per day and $10,000 total. Okay. There is job restoration requirement. So under normal FMLA, you're required to return people to their normal job. This is included in this expansion as well, unless you work for a company with less than 25 employees, and 3 criteria have to be met. So if the job is no longer available because of effects of the public health emergency, you have made efforts to return the person to an equivalent position but couldn't, and you agree that during the next year you will reach out to that person if something opens up for them. So all those criteria would have to be met if you're under 25 to not return somebody to that position. And then there are tax credits attached with this, which will cover 100% of what the employer is having to pay out under this part of the act. And I'm going to talk a little bit more about that in a minute. Okay, emergency paid sick leave. This is the second part of the act, and this is for private employers under 500 employees and all employees who meet the definitions below. And there are 6 ways to qualify to use this paid sick leave. Now, this paid sick leave is only for the 10 days. It's 80 hours, and it should be used for the first 2 weeks of that leave if people qualify for it. So anybody can be eligible for this regardless of how long they've worked for your company. It starts April 2nd, ends 12/31. As far as I've heard, these acts are not retroactive. In other words, if you have taken employment actions before April 2nd, I don't think this is retroactive. That's the guidance I've been given up to this point. So who's entitled to use the paid sick leave? Well, it's employees who cannot work, and keep that in mind. Same thing with the FMLA expansion for employees who cannot work. So if you have employees who are at home and they can work, then this doesn't apply to them because you're paying them to do the work, okay? So for employees who cannot work, if you look at 1, 2, and 3, that's really about quarantine. So if the government has told them they need to quarantine, a doctor has told them to quarantine, or they have symptoms and are self-quarantining like that. And then 4, 5, and 6 are different. 4, 5, and 6 are, I'm not sick, but I'm caring for someone in my household who is sick, or I'm caring for children because school is closed. And then the last one is typical government language, experiencing substantially similar conditions as specified by the Secretary of Health and Human Services, but it has not been specified. So whatever that is, I don't know, but it is also the 2/3 pay applies, and we'll look at that. Emergency paid sick leave requirements. What are the pay rates? So it's for full-time employees will get up to 80 hours, and it's 2/3 of their pay up to the cap. If you look a little farther down the slide, depending on the reason they're using it. So if they're using it for reasons 4, 5, and 6 on the previous slide, which are, caring for someone in their household, or they have kids at home because schools are closed, then it's 2/3 of their pay up to the cap of $200 a day and $2,000 total. If they're using it for reasons 1, 2, and 3, which are like they've been told to quarantine or they have symptoms and are home, that kind of thing, then the payment's capped at $511 per day and $5,110 total. Part-time employees would get paid for the hours they would normally work. If they have not worked recently, you would look at the time they normally work over a 2-week period, and that's how you would figure that out. And this paid leave is in addition to whatever sick leave already offered. So what that means is some of our clients and other companies have already offered to employees, hey, we're going to give you 3 additional paid PTO days or sick days to help with this, that kind of thing. So if you've already offered that, this is in addition to that. You should not require employees to use their other company paid leave and vacation before they use this if they are eligible for this. So if they are eligible for this and they're home and they can't work for any of the reasons on the slide before, there they are again. And by the way, everybody can download all of these slides. They're attached to the login and you can all download them. Also, employers may change their leave programs and policies even after the bill is enacted at this point. Okay, the questions are just piling in like crazy, so I'm going to look at a few of them. Are healthcare provider exclusions still included in the Act? Yes. Let's see. Should an employee self-impose a quarantine if they have been on domestic flights? I think that's up to you. We do have a slide about that. The list of places where travel is considered higher risk has gotten longer and longer and longer. Domestic flights, should be okay, but I am suggesting that people exercise caution in this case. So it's really up to you to talk about what you think makes the most sense for your business. Let's see. What if there's telework available to the employee? We are recommending that people work from home if possible. I know not everybody can do that. Let's see, define your kids. What if you have a girlfriend or boyfriend or somebody living in the house, that kind of thing, that share kids? Yeah, I don't know how they define kids beyond just your own biological children, but maybe that will be addressed in future explanations. Also, another person asked about who is considered a healthcare provider. Believe me, that's a question we all have that has not been defined. And that's a big question that remains out there that we're hoping we'll get clarification on pretty soon. Someone asked about the 10 days. Is it 10 business days? Yeah. When they say 10 days, they're talking about 80 hours of paid sick leave, like 10 work days. Okay. All right, let's keep going here. What about tax credits and exemptions? By the way, if anyone jumped on late to the presentation, we are recording this and this will be available for free, like all of our webinars, as a service to our clients, prospects, friends, and families on our website at threadhcm.com. Go to the resources page and look at our webinars and other resources we have there for free. Okay, tax credits and exemptions. Tax credits are built into this act to cover 100% of the payroll taxes related to this. So basically it will come out of your FICA, your Social Security and Medicare that's owed by the employer on the wages that they're paying towards these emergency leaves, subject to the caps that are applied to what you have to pay for the emergency leave, okay? The amount of credits can be increased by qualified health plan expenses, attributable to leave wages. What that means is the employer portion of premiums that are paid while people are out on leave. So the government did anticipate that companies would have extra expenses if they have to continue benefits while folks are unable to work but being paid. And so the companies that are paying the employer portion of insurance for that is supposed to help with that as well. And again, employees under 50 employees could apply for an exemption. We don't know how that works yet, but we will let you know as soon as we find out. And that's for the paid sick leave and for the FMLA expansion. Okay, what about testing? This act also requires group health plans to cover COVID-19 testing related treatment without cost sharing charges or other limitations on plan participants. So they're trying to help as much as they can. All right, now let's get into some of the quarantine questions. Could we send employees home involuntarily if they're exhibiting symptoms? Yes, you may. I mean, this is a different time. I think we're all cognizant of that. It's an unusual circumstance. My guidance to most of our clients is to run your business, do what you need to do. If you have questions about legal issues, talk with us, talk with your attorney. But for the most part, you want to be cautious. You want to be safe. What this is about is surviving this downturn as a business and as people individually. So you want to keep your employees safe, your customers safe. You also want to protect your business in any way you can, because we want both to get through this, come out on the other side. And you can send employees home if you're worried about it. And if they're exhibiting symptoms specifically, you can ask them to go home and self-quarantine for a little while. Recommend that they do a teledoc visit, or go to the doctor and get tested if they are having symptoms. People who don't have symptoms, I know they've been asked not to go get tested because there's a limited amount of tests available still. I know the government is working on drive-through facilities and those kind of things and increasing the testing availability. But for now, if you don't have symptoms, you probably shouldn't get tested. Some people I've heard have actually had symptoms, self-quarantined at home, and their symptoms were gone in a couple of days and they felt fine. So it's not going to hit everybody the same. Just follow that CDC guidance and make sure you don't discriminate. So with any employment action where you're having to make decisions about which employee gets sent home, which employee stays, which employee gets furloughed, which employee gets pay reduced, anything like that, always think about, is there a business necessity reason for that? And make sure you're not making decisions based on any protected classes, such as race, gender, age, those kind of things. So this text got a little wonky on the slide. Apologize about that. But basically it says, can we ask about symptoms? Yes, you can, but you only ask about COVID-19 symptoms. You don't want to ask people, what's wrong with you? Or do you have any kind of disease or anything like that? Are you immunocompromised? Or what you want to do is ask them, if you're experiencing fever, cough, or shortness of breath, please self-report to HR or your designated person, so that we can address it from there, because we want to protect you, but we also want to protect everybody else. And that will start the process of how do we communicate this to other employees, and I'll talk about that as well. Is an employer's knowledge that an employee has COVID-19 subject to HIPAA's privacy restrictions? So this is an HR question that the HR folks are thinking about. Not usually, unless you gain that information as your role as the administrator of the health insurance plan, because most of the time the way we're going to learn about someone having it or having the symptoms is they're going to tell the HR, they're going to tell somebody at work, and you're going to hear about it that way. You should always keep it confidential. It is okay to talk to other employees who are affected by, like say I worked in the same room or work area with someone who's now at home because they're having symptoms. It's definitely okay to tell those folks, hey, someone in the work group is self-quarantining, is at home. You don't want to share names or any identifying factors. You don't want to go, I'm not going to share names, but it rhymes with bot and looks like Scott. That's a kind of a giveaway. So Be cognizant of respecting people's confidentiality as much as you can. Big question I've gotten a lot is, can we screen visitors before they enter our building? Can we screen employees? These infrared thermometers. You don't want to stick something in somebody's mouth or anything else. You want to have an infrared thermometer if you decide to do this, that, goes in front of people's faces or on their forehead or whatever. But you also have to be really careful with this. So the EEOC originally said not to do this. Now they're saying you can, because this is just a little bit more of an extreme situation. Nobody has said for sure whether this would help prevent the spread of anything. So there's no guarantee that this will make a difference. It's really more for peace of mind, I guess. So I typically advise against doing this. People consider it kind of an intrusion. And I know some of you are saying, so what? We need to do this. So it's really up to you. You could get in trouble with union issues. You could get in trouble with HIPAA issues. You could have people who refuse to do it, and then now you're dealing with that situation. So in my mind, it can cause more problems than it's worth. I think it's better to just be safe and have people work from home if they can. If your employees have to be at work to work, then what you want to do is really educate them about the symptoms of this illness, and then ask them to self-report the symptoms, put things up around your workplace, communicate regularly so that you're staying on top of it, and make sure everybody has access to the latest CDC information. Can we send somebody home who does not have symptoms but has been in close contact? So this kind of question has come up a lot, and close contact is getting more loosely defined because now it's like everybody knows somebody who has symptoms. And yes, you could send somebody home if you're worried about it. I mean, you can run your business. Like I said, you don't want to discriminate and you want to be on the safe side. So if somebody says, hey, I've been in close contact with someone who has symptoms, especially someone who's in my household, then you could do that in the name of safety. On the CDC website, they have a kind of quick reference chart which shows who is high risk, medium risk, and low risk. So right now what it's saying is, high risk would be people who are living in the same household who have traveled to high risk areas, specifically people who are in, sorry, my watch went off. Medium risk, if you're in close contact with a person who's symptomatic with confirmed COVID-19, all kinds of things like that. Low risk would be travel from countries that are not listed on the high risk list, or domestic travel to areas that do not have high percentage of people who've been infected and those kind of things. So look at this chart if you want to on the CDC website, and that will help you determine levels of risk and who should be sent home and who shouldn't. Could we require employees returning from travel to stay home? Yes, you can do that. And I've listed here the latest as of yesterday. These are the areas that are listed as level 3 travel risk. So level 2 is kind of like, hey, use caution. Level 3 is, this is iffy. You should probably not travel here because you'll be putting yourself at risk if you do. And that list has gotten much longer, as you can see, than it was even a week or two ago. So I would reduce travel to all of these places if you can. Take any protective actions if you can't. And then again, look at cdc.gov/coronavirus for updates to this list and how to handle this. So what companies are doing is they're asking people to stay home depending on where they've been to and how long they've been gone and what they've exposed to. The length of time that you would ask people to stay home is different. I've seen people say, can you stay home for 24 until you're 24 hours symptom free? And then I've heard companies say, well, there's a latency period for the COVID-19 that's averaging about 5 days before people show symptoms. So maybe we'll ask people to stay home 5 days plus 2 days without symptoms. But if you've been to some of these areas, or especially if you're a healthcare worker, a lot of people are asking people to stay home for 14 days and then don't come back until you've been symptom free for 24 hours without the use of medication. Can we ask them to stay home even if they have not traveled and have no symptoms, just as a precautionary measure? And the answer to that is also yes, as long as you can have your employees work from home, because remember, you want to keep paying them to do the work if they can work from home. So when should they return? That's what I just talked about, what we're seeing on a best case scenario, but it is a case-by-case issue, and you should leave it up to the doctors on when they can return. So if you have an employee who had symptoms, has been asked to quarantine, or is self-quarantining, or you're requiring them to quarantine due to travel to high-risk places, then you should do it on a case-by-case basis. But if people have symptoms or any of those things like that, they should definitely leave it up there to their healthcare provider or doctor to say when it's okay for them to come back to work. What if the employee says, hey, I feel better. I haven't had symptoms in 24 hours, but I still don't feel safe coming to work. I want to stay home. And if they can work from home, I definitely encourage you to consider that. It seems safer anyway. Just to be practical while all of this is going on. Hopefully this is a temporary thing that we will get through pretty soon. I would definitely think you should encourage employees to stay home until they feel better if they had to go home because they were symptomatic up to a reasonable point. And just remember, don't discriminate along those lines either. Can you require a doctor's note before people return to work? Yes, you can require a doctor's note. I know for a lot of companies that's the standard practice. The CDC asks that you do not do this. The reason they're asking that you do not require a doctor's note is for several things. One is the demand it will put on the healthcare system. There is a lot of demand on healthcare system right now, as you can imagine. And what this could do is actually delay people from coming back to work when they could be eligible and safely return to work, because they're waiting on an appointment with a doctor so that they can get a note. So it's up to you if you decide to do this or not. CDC recommends you don't, but you can legally do it if you want to. And there are situations where you as an employer could say, look, we think this is a serious health condition, exposing people to a direct threat. And so that's why we're requiring this note. And that's the language you would refer to if you wanted to do that. What about if someone has a doctor's note says, I'm okay, but you still don't want people coming to the office? You can do that. If your employees can work from home or work remotely, it is okay for you to say, look, okay, we're not coming back to work yet. Everybody needs to continue working from home until further notice, and we will keep communicating and let you know when we think it's okay to come back to the office. It's your office, it's your space, so you decide what you want people to do there. What if an employee has no symptoms, is not self-quarantining, doesn't have kids to take care of at home or anything else, and they just say, I don't want to come in. I'm afraid to come in. I'm not sick. I don't qualify for some of those other things. I am able to work, but I just don't want to do it from home or whatever. So you can require people to come in as long as there's no legitimate threat. And they don't require an accommodation, like any kind of disability accommodation or special needs accommodation. But there are some things to think about. So under the National Labor Relations Act, which does apply to unionized and non-union employers alike, non-supervisory employees could have the right to refuse work in conditions they think is unsafe. So employees say, hey, I think it's unsafe to come in. Be cautious about forcing them to come in or have conversations about that. It is okay to call somebody up and talk about why your workplace is safe, if you believe it is, and the steps you've taken to make it safe. Also, there's some rules under OSHA that talk about protecting employees who refuse to work if they feel like they're at risk of death or serious physical harm. And obviously each situation is different, but I know people have a general fear of contracting this and don't want to get it. People are getting testy in the line at the grocery store and whatnot. So just be aware of that. Always remember to be a human being. That's what I'm telling everybody, is talk like a human, think like a human, behave like a human, and we'll get okay. We're not robots. So time and money. We are getting there, and I'm going to look at a few more questions. I hope y'all are still with me. I know I'm talking a lot. One of the questions is there any consideration for a special needs son or daughter who is over the age of 18? I have not seen anything on that, but that is a good question. And we'll make sure to look into that and follow up on those kind of things on our call, which is Tuesday at 11 o'clock Eastern time. Okay, I'm just looking at a few more questions here. What if our normal work week is not 40 hours? So the typical requirement there is to pay the normal hours worked up to 80 hours for the paid sick leave, or if they're part-time employees, you would pay the normal average they work for the 2-week period. Let's see here. How can we determine if employees are able to work? That's a good question. So that is tricky, because you have to talk about, do we have the capability? Do we have the technology? Do people have a home office if needed? Do we need to purchase equipment if needed? It depends on how important it is for people to be able to work from home, and you just have to test it out and see how it goes. And we're going to talk about work from home policies in just a minute. Someone asked, will the slides be made available for download? Yep, they are available now for download. I don't know if you see what I see, but there's a thing at the top of my screen that says event board, and then under there it has attachments, and you can download everything from there. We have multiple attachments, including work from home sample policies, including state law charts about the WARN Act and requirements, about FMLA requirements by state. We have sample letters, what to do if you're aware of the illness in your workplace. All kinds of resources are already attached to this, and all of them are available for download. Okay, we will keep going. Does this give us an opportunity to bypass wage and hour compliance because this is a crisis? Like, there's a special circumstance. Can we do things we wouldn't normally do, pay people differently than we normally would? You can do what's legal under the law, but my advice is to not bypass existing wage and hour rules under the Department of Labor. They still do all apply. The pandemic is not an excuse for non-compliance with those things. So here are the basics in terms of pay. This is what you need to remember for hourly employees in terms of people who are working. So this is for people who can work from home and who are working or can work in your business. So hourly non-exempt employees, you have to track and pay all time worked, pay them at least minimum wage, and your state's minimum wage may be higher than the federal minimum wage. So make sure you're checking. You would pay whichever one is higher. And then they get overtime pay as required by federal and state law. So in most states, overtime is 1.5 times the regular rate for hours worked over 40 in a single work week, not combined. Like if you have a biweekly payroll, you're not averaging their time over 2 weeks. It's each week is looked at individually to determine overtime. Now, one question that came up the other day is, what if an employee says, hey, I love this company. You couldn't pry me away from this company. I will do anything for this company. I will work for free. You can pay me $2 an hour. I don't care. And some of you, I know your eyes are bulging right now, but believe me, it does happen. And employees do not have the legal right to waive their minimum wage or to work off the clock or anything like that. So if you think you're kind of doing someone a favor, it will come back to haunt you later. So I would say don't do that. Salaried employees need to get their full salary in any week they perform work, subject to very few limited exceptions. I'm not even going to talk about those exceptions because they tend to get companies in trouble. I would just say if you're ever considering docking a salaried employee's pay, like paying them any less than their full salary, then you need to talk to HR first before you decide to do that, to make sure it's okay to do that. Okay. And that I'm only talking about the salary basis, which means you paying the fixed salary amount each week. What if you say, can we reduce pay for our current employees? So we're still providing work, we're letting our employees work, but we want to reduce what we're paying our hourly employees and reduce what we're paying our salaried employees. You can do that. But for salaried employees, for them to remain salaried, they would have to be paid at least $684 a week, which is that $35,568 per year, unless your state has a higher threshold. So if you're in New York and California, you can assume every time I say, unless your state has something different or higher, then you probably have that in your state. So you definitely need to look at your state rules to make sure you're doing whatever is best for the employee. That's the rule. If your state has more rigorous requirements that are better for the employee, then you would be required to follow those instead of what the federal minimum wage is, right? So salaries have to be fixed. They cannot vary. So it's okay for you to go, hey, right now you're making $800 a week, but we're going to knock you down to $684 a week. You're still salaried exempt. The time worked does not matter. So whether you work 30 hours in the week or 100 hours in the week, you're still getting this $684 salary every week. It's not determined on time, okay? Communication is really important. You have to think about if you have a contract with anybody, you might have to look at that contract to determine if it will allow you to do that. If you're in a union environment, you have different issues you need to address as well with the contract before you did anything like this. Talk to your attorneys about that. But you can reduce hourly pay as well, and you just have to make sure it does not go below minimum wage, and you're not deducting things from hourly pay that would put them below minimum wage. So if you have somebody who leaves your company and then you say, we're going to charge you for uniforms and a computer that you lost and things like that, you don't want to take them below minimum wage. So you take that final paycheck, divide by the hours worked, and then see if you could deduct what you needed to deduct or not. It's always a good idea if you have to deduct anything that you've shared that in advance and people have signed off on it. Can we choose to send some people home and then keep others at work? Yes, you could do that, because some businesses have positions that are essential and positions that are nice to haves. And so I know I have seen some companies saying, hey, we love this position or this department and what they do for us, but we can't afford to hold on to them right now. And some of that is happening. So it is okay to do that. You just want to make sure you look at the reasons why you're choosing groups, and it's better to do it based on a objective reason, like, okay, it's based on business necessity, it's based on our needs at the time, and make sure you're using those reasons instead of any kind of discriminatory reason. Another big question that we're getting a lot is, what is the difference in these terms here? So what's a furlough, layoff, or reduction in force? Well, a furlough and layoff are terms that are used interchangeably a lot. So they're getting closer and closer to meeting, but the idea is that a furlough is a temporary reduction in time worked. So days or time that people are working, which reduces their pay. And you might say to employees, okay, we're going to work 3 days a week this week instead of 5, and we're going to do that for the next month and see how it goes. So that would be an example of a furlough. They're still active employees. They're still on your payroll. They're still getting benefits. A layoff could be a temporary layoff, which is why it's often confused with a furlough, because a temporary layoff and a furlough are very similar, but a layoff could become permanent if you're unable as a business to return people to work. The idea with a layoff is that you are separating people from payroll, so they're no longer getting paid, but your intent is that you can hopefully ask them to come back to work once business picks back up and you get through this. So benefits would normally end per your plans, but could be continued with a plan amendment. So if you want to continue to pay benefits during a layoff, some companies will say, we're gonna cover your benefits for the next month, even though you're not on working. Make sure you get with your broker and see if you need a plan amendment to be able to do that, because I have heard of companies who made that promise, put it in writing, and never looked at their plan documents, which is a common thing. Most people don't ever look at their plan documents. HR people too, believe it or not. So look at your plan documents, talk to your brokers before you make any statements about what you can or can't do with those kind of things. Reduction in force is basically you're having to cut some of your workforce. Those are terminations. Return is not expected. I mean, it's possible, but it's not expected, and the benefits would usually end per your plan. So for a lot of companies, that's end of the month for date of termination. For some plans, it ends the date of termination. But again, you have to look at your plan documents to determine what that is. Are employees under the furloughs and layoffs and reduction in force, if those happen, are they eligible for unemployment benefits? In almost all of those cases, yes. The government is reducing eligibility requirements and all kinds of things like that for unemployment to make it easier for people to get unemployment. We'll talk about that. And then some states are requiring employers to file for partial claims. So in other words, most of us are used to filling out a separation notice in states that require it and giving that to employees, and employees apply for unemployment through their state unemployment agency that way. But in this case, if you're doing a mass layoff, some states require you to fill out a mass notification that the employer fills out and delivers directly to the state agency that handles unemployment. In Georgia, that is required. Any group over 25, you have to do that. And if you have people who you are furloughed, let's say they're working less hours, less time, even though they're still your employee and they're still getting paid, they're getting paid less because they're working less. In that case, you could file a partial unemployment claim. In Georgia, you are required to do that. And there are penalties if you do not do that. And a lot of other states are starting to require that. So we're trying to keep up with that as well. And we'll share more with those requirements as they become available to us. What's happening under this act and with the government and emergency relief is that the federal government are trying to work out a way to give extra funds to the states where the unemployment costs and rates are going up. but they won't do that unless the states do certain things. Like the states have to require employers to provide notification. In Georgia, we do that already, so that's no change. We give everybody a separation notice when they're terminated or they resign, but not all states do that. So you have to look to your state sites and government sites to see if those notices become available if you're not used to doing that. Also, the states need to provide assistance when people are applying for claims, and they're expected to ease the eligibility requirements such as waiting periods and search requirements, meaning saying you can't get this unless you continue to prove that you're searching for a job, that kind of thing. Because this FMLA expansion is different, right? And you may have people who are at home and can't work, and they might want to be able to collect unemployment or partial unemployment. So also they're trying to make sure that the states don't charge the employers who've been really directly impacted by the COVID-19 drops or who are under the direction of a public health official quarantine. So if the whole state says, if our governor or state officials or public officials say everybody has to quarantine and work from home, you have to shelter at home, that kind of thing, then what they don't want to do is when you have a bunch of employees file unemployment, if they can't work from home, is they don't want the employers then to get hit with big rate hikes for something that was really beyond your control. And so that's what they're trying to address with that. So the WARN Act is something I've got a lot of questions about, and that we do have a reference for you that is attached to this as well that you can document. It has a state-by-state chart to show. You may have heard the term mini WARN Act, and that is for states that have a thing about this. And what this is about is if you have a bigger company, over 100 employees, and you're doing a plant shutdown, or you are going to do a mass layoff that is 33% or more of your workforce, then what you're supposed to do under the WARN Act is give employees a 60-day notice. Now, there are exceptions to when you would have to give this 60-day notice, and the burden of proof falls on the employer. So it's up to you as an employer to prove that you could meet one of these three criteria. And one is if your company is faltering, you're worried you're going to go out of business. And if you announce that you were going to do a mass layoff and all employees left, it would literally put you out of business that day. Unforeseeable business circumstances, which is you didn't anticipate this. I think a lot of people go, yeah, I could definitely use that. I think now most of us do see these business circumstances, so they may be harder to argue. And then natural disaster is really, right now, it's not written to address what we're going through. It's more about floods, tornadoes, fires, things like that. But look at your state requirements for the WARN Act. If you're under 100 employees, it does not apply to you. Would it trigger a reduction if you had a reduction in hours or a layoff, would that trigger COBRA? So you got to look at your plan documents, because you could have a qualifying event under COBRA, like a reduce of pay, hours, those kind of things. But if you're continuing to offer benefits, then you're not going to offer COBRA. You're really going to only offer COBRA if the benefits end. But if you do those things and your benefits do end, that's when you would want to offer COBRA. And you could talk to your COBRA administrator about making sure you do the proper notice and follow the proper timelines for that. Okay, we're still cooking. I hope you're with me, folks. We're trying to give you as much information as we can. We are getting there, I promise you, but I'm just going to keep plowing along, and then I'll hit as many questions as I can for anybody who can hang out and stick with me at the end, okay? We are scheduled until 11:15, so we're still doing okay. And I can stay a little bit longer than that as well to answer questions. So please be patient with me as we try to give you as much information and as many details as we can. I know this slide presentation might not be as pretty as some others you've seen, or for folks who know me, I usually do like a photograph and maybe one word on a slide, but there was so much content on this, and I wanted you to be able to see it, especially for those of you who are anxious about it and wanted to download the presentation. I wanted you to have as much information on the slides as possible, because I know there are many times I have downloaded a PowerPoint and looked at it after the fact and been like, what in the world was that talking about? And I don't remember. So that's why we set it up this way. So I hope that's okay. All right. Can you require an employee to use paid time off? So this is talking about like company paid time off. If you already have a company plan that gives vacation, sick, personal time, can you require employees to use that? So I'd say first, check with, are they eligible to use the Families First Act, the paid sick leave that's under that? If yes, they would use that first, because you're not supposed to require them to use other leaves before that, even though there is language in the law that makes that a little confusing. You should check for this first. If they're eligible for the paid required leave under this act, they would use that first. If they're not, then you could go to your company plan or whatever you're offering there, and just make sure it's subject to any state laws and your current policy, which you can change. Can we require them to use PTO in less than full day increments? So could you say, hey, if you're using PTO and you're working some and you're taking some time off, can you use PTO in a half day or something like that? For non-exempt employees, yes, you can do that as long as your policy says it and your state laws and local laws allow it. And then for exempt salaried employees, what you want to do is you still pay them their full salary, but you would do a deduction from their PTO. For example, I'm paying your full salary for the week, but let's say you didn't work half the day Friday because of whatever the reason is. I could deduct 4 days from your PTO bank from that, but you're still getting paid your full regular salary. We're not touching that, if that makes sense. What if our current PTO policy doesn't cover this? So you can change your PTO program and policies. I know I keep saying that, but that's important to know. Not that everybody wants to run out and rewrite all their policies, but sometimes it's okay to write temporary policies and say this applies for the next 3 months or the next 2 months or through the end of this year. Whatever you want to do, you do have the right to do that. You want to make sure you're compliant with all the required emergency leave payments that we talked about, the family medical expansion and the emergency paid sick leave first. And then if you don't have additional PTO or your PTO doesn't cover something like this, you have the right as an employer to say, could we extend our PTO policy to employees? Could we give them some extra days? Could we let them use days without deducting from the bank? You can do those things. It's up to you to do that because PTO is mostly discretionary other than when it's required under certain situations. So what if we don't have PTO or paid vacation at all? I mean, we do have clients who just, their business model doesn't really give them the opportunity to be profitable and to be able to offer some of these things. So they're in industries where it's very difficult to offer great benefits and offer paid vacations and things like that. We're aware that those exist, and that's going to be tougher for those industries. And those are the industries that the government is focusing on specifically for help with small business loans and other tax issues. So what you can do is you could choose to offer some kind of paid sick leave. If you could afford it, if it doesn't apply to you, you could choose to relax your attendance policies. You could choose to be flexible with schedule sharing, say, okay, we're going to reduce schedules or we're going to alter schedules or things like that. You just kind of got to get creative as you can if you're not able to offer this at all. Now, if you are meet the requirements under the Emergency Families First Act, then you are required to do that. And if you're unable to make those payments at all, then I think you got to talk to your attorney, especially if you're over 50 employees and you're unable to make these payments. You've got to come up with some kind of solution. Otherwise, you could be penalized after the fact for not doing it. Could we alter our policies to create new policies? Yes, you can. There is sample work from home language attached. There are many different versions of work from home policies floating around the internet. Just get them from sources that you can trust, run them by your HR team or your legal counsel if you want, and make sure you're hitting the things you need to hit. Like, okay, what are the expectations of hours worked? Are you going to work the normal hours? Normal hours are 8 to 5. That's when you're expected to be working, to be logged in. Some companies have the technology where you can see that employees are logged in, or they're using instant messaging. We set up a team chat here at Thread, even though we have multiple ways to talk to each other, that's a quick way for all of us to share information. We have multiple groups on there, one for our leadership team, one for all employees, so we can talk amongst ourselves, or we can talk to everybody just really quickly using the chat feature. We've also done video meetings where we've all gotten together, just looked at each other's faces because it's nice to see each other, got to see what people's kids and dogs look like at home, and that's part of the drill. So understand that there's a little bit of flexibility needed in a situation like this, but it is important to explain to people in your work from home policy, even if it's temporary, when they're expected to work, when they're expected to be available, how they should respond, how you're going to be looking at productivity, how often they should check in, how you're going to handle expenses, all kinds of things like that. And then you want to make clear how long this thing is going to last. If it's just temporary, make sure they understand that it is just temporary. Must we pay hourly employees during a temporary shutdown? Let me go back for a second, because expenses, got a lot of questions about expenses here and what do we do. So you are not required to build a state-of-the-art home office for any employee that you ask to work from home. Most people do have a computer at home. You're not required to purchase a printer for their home office that they can now keep at home, that kind of stuff. If they need to do printing at home and you're requiring them to work from home, then you might need to buy them a printer, right? So you would cover things that are reasonably expected. You should give them a limit. I think the policy that we have attached here says anything over $40 needs to be approved. But keep in mind, anything that we have attached, you can edit as needed. And I would expect you to do that. A lot of them have little red comments that say, fill in your information here, that kind of thing. So if you want them to approve every expense from home, you need to put that in the policy and just make it short and sweet and clear for everybody. You are not required to pay people's internet charges at home, because they say, I'm using some of that now for work or my phone bill or whatever. Some people do still have a home phone, believe it or not. But if you're requiring them to use some of that, you could consider doing that. So it's up to you how much you do or don't do. What you don't want to do is require employees to pay for extra, like you need to upgrade your internet service and you need to pay for that. And then all of a sudden that extra cost puts them below minimum wage, because that would come against kind of what you're paying them. So be careful about things like that. Okay, must we pay hourly employees during a temporary shutdown? So first thing is always, okay, you have a temporary shutdown. If it happens April 2nd or after, then you are looking at this Emergency Family First Act, and if they're not working due to the criteria that are there, then they might need to be paid according to that, right? If they meet the paid sick leave issues that we talked about earlier, they might need to pay it according to that. But if they're not entitled to those, and they're not working, then hourly employees would not be paid. So hourly employees normally only get paid for the hours they work and don't have to be paid for the hours that they don't work. You can choose to pay them if you want to, but you don't have to unless you're required to under some of this required emergency paid sick leave or family leave expansion. If you are forced to close your business entirely, so you're shutting down the entire business and you don't know how long that will last, then you will probably be in a situation of either a layoff or a reduction in force, where you're letting everybody go and hoping you're able to bring them back, but there are no guarantees. Then definitely talk with your HR professionals and your legal counsel to talk about what you should do in that situation, because there's so many things to talk about. And then if some states have predictive scheduling laws or minimum report to work laws that are like, if you change my schedule within a certain time frame, you have to pay me a certain amount, or if I report to work for the day and then you send me home, you're still going to have to pay me a minimum number of hours because I showed up at work. So check with your state laws about those requirements as well, to make sure that if you shut down midday or midweek, you may have to pay people a little more than you thought based on those requirements if you're in states that require it. All right, must we pay exempt employees during a temporary shutdown? And this is a different issue. So for exempt employees, there's a lot going around about this, but the things to think about are if the employee said, okay, I'm sick or I need to care somebody, and I need to stay home, then there are situations where you could deduct a full day absence if the employee is not working. The key is not working. If exempt employees work part of the day, they get paid for the full day. If they work part of the week, they get paid for the full week. So unless you can prove that your salaried exempt employee is not working, not checking emails, not making phone calls, not working on projects or anything else, then you could do this, but it's typically hard to prove that. If the absence is initiated by the employer, you're telling them they have to stay home for mandatory quarantine, things like that, then you could dock the exempt employees' pay only for full 7-day absences. So they're out for a full week with no work. My general advice for everyone when it comes to docking exempt salaried employees' pay is before you even think about doing it, talk to HR or legal, because there are some situations where it is legal to do it, but I don't see situations where it is wise to do it very often. So I would advise you not to jump the gun with that. Talk to your HR and legal before you start doing anything like that. All right, expenses. I hit on that just a minute ago. You can reimburse for extra expenses beyond personal use if you choose to, but you don't have to cover all that stuff, and you don't want to take them below minimum wage as well. We talked about that. All right, quick sip of water, and I'm going to look at some of your questions. These are the ones that I had built in already, and I hope y'all are still with me. Everybody take a deep breath. Shake your arms out, roll your head around a little bit, move your shoulders around. Just stick with me. I know this is long, but it's worth your time, okay? Should you discipline employees who are away from work because of COVID-19 for violating your attendance policy? I would say, please don't do this. And then again, let me remind you of what I said at the beginning, which is there are two things to consider. What's legal for you to do as an employer and a leader, and what's right for your business, and what's just generally decent overall. And I think if people are concerned with their kids getting sick or elderly parents getting sick or they're having issues, whatever it is, this is probably a time where we should be understanding and flexible about that. I totally understand that there are many small businesses out there who do have all the compassion in the world for their employees and are hurting because they're not allowed to pay them what they wish they could, and all of that. And sometimes they just don't have any choice. They've got to keep the business going so that there's something there for employees to return to. And that's important for everybody to understand, is that there are tough choices being made out there in the world. And I have conversations with business owners, and it pains them deeply to make these decisions because they love and respect and appreciate their employees, and their decision sometimes comes down to, do I keep the business alive so that there's a place for employees to come back to, or do I try to keep employees temporarily, which could end up putting the whole business out, and that's a tough position to be in. So I see everyone's concern on both sides, but that happens sometimes, and just understand that those are the considerations that people are having to deal with. But try not to discipline people or give them a hard time. Try to relax your attendance policy a little bit if you can in this situation. So some HR folks are on here. We've got, 400 or 500 people on the webinar today, and a bunch more who wanted to get in, and we'll probably be viewing the recording. So again, we appreciate your patience, and I know that HR folks ask questions that non-HR people might be going, what are they talking about? But serious health condition is another reason that people can take regular FMLA. So regular FMLA is for companies that have 50 or more employees, and there are other requirements for employees to be eligible to use it. So if people want to use FMLA for a reason beyond this emergency relief, so remember, the emergency FMLA expansion paid leave is only for people who are staying home, who cannot work, to take care of kids who are under the age of 18 or 18 under due to public health emergency, right? So if they can work, it doesn't apply to them. If it's not for those reasons, it doesn't apply to them. So people may say, I want to apply for regular FMLA for a serious health condition. Well, that may or may not qualify as a serious health condition, because for most people, it's just a very temporary thing. Even though you may self-quarantine for 2 weeks or a week, most people are only sick for a couple of days, and then they start feeling better. So may or may not. Most cases will not qualify as a serious health condition. A lot of people don't even get medical treatment. They just go home and go, okay, I'm feeling better the next day, and they ride it out. So there are certain requirements under FMLA, the Family Medical Leave Act, to qualify as a serious health condition. And you have to talk to HR about whether they qualify for those or not. If they're seeking treatment and they do enough treatment and ongoing treatment, then it could possibly be covered. But remember, again, the emergency FMLA leave is only for employees who can't work because they're taking care of their kids, because the schools are closed, because of a public health emergency. Woo! Is it considered a disability? So normally it is not, because the duration of it is not long enough. And disability is protected disabilities under the Americans with Disability Act usually don't cover things that are just temporary conditions, right? Now, complications from it, if someone gets pneumonia and they have other issues that last much longer, those could trigger obligations. And what those obligations would be is the employer always has to start with the interactive process. So anything related to Americans with Disability Act starts with the interactive process, which just means, for those of you non-HR folks on the call, that you're having a conversation with people and saying, hey, what can you do, not do? Can you perform the essential functions of the job with or without reasonable accommodation? Can we get creative? Is there another thing we can look at that will help you to continue to work, to return you to work? That's the interactive process. It's just having an open conversation, making an effort to help people be able to work if they can, okay? Look at your state. If your state requirements, as always, I don't know if you caught at the beginning of this presentation on our second slide, it says anything is subject to change with legislation. Check state laws, check your policies, and consider the circumstances. So that goes for almost everything I have said today. I am not an attorney. I am not a doctor. I'm just an HR geek who wants to help people. That's why I'm here. So please don't hold me accountable if there's something that I didn't get perfect. We are doing our best to deliver the most up-to-date and accurate information as we go through this. Believe me, you will not hurt my feelings. If you call me on something, you'll be helping me out, because then maybe I can look it up and get it right on the next one. But everything I've said today, I believe to be accurate after days of verification. So you can trust me on most of this. All right, if we treat an employee as if, what this question is about is the ADA protects people who have a disability, people who are caring for someone who has a disability, people who are regarded as if they have a disability. So there have been ADA claims in the past where a manager treated someone as if he had a disability when he did not. An old story is about a guy who was limping across the parking lot in the grocery store, and the manager said, I can't have you out there bringing in carts all day because you're having trouble walking and it's too slow. And the manager thought he was disabled, wouldn't let him do it, and let him go, and ended up the employee had just twisted his ankle, and it wasn't a disability, but he treated him as if he did have a disability and was protected because of that. So that's a long preamble to why is this question included in this presentation. This question is here because some employers who are knowledgeable about ADA are worried, what if I ask an employee to stay home or force employees to stay home for safety reasons? Am I treating them as if they have a disability? Most likely not, because the amended ADA makes clear that regarded as claims may not be brought for conditions that are transitory and minor. Now, you might not consider this minor, but it is transitory, so the odds are very high that you would not have a claim under that situation. All right, what if employees asked to wear their own protective equipment like gloves or respirators? What do you do in that situation? So you could allow them to wear those things if you want. Here's a good message you can share with employees who want to wear respirators. Both the CDC and the Surgeon General have confirmed that the masks are not necessary. Basically, they're saying if you have coronavirus, wearing the mask would help you prevent the spread of it. But if you don't have it, wearing the mask is probably not going to prevent you from getting it. So if you're walking around wearing a mask all day and you don't have symptoms and all that, this is not really helping much, according to them. So you can let people wear them if they want, as long as it doesn't create a safety hazard for where you work. And you can deliver this message to them as well. Are there OSHA requirements that must be followed? There is an entire OSHA guide that is not specific to COVID-19. They have edited it a little bit to adjust it. It's about, like, workplace emergencies, illness in the workplace, infectious diseases in the workplace, those kind of things. And it does reference COVID-19 a couple times. So that document is available out there through OSHA, OSHA.gov. So in general, OSHA requirements are going to be that you're expected to provide a safe workplace. So you want to take steps to make sure you're doing that. And we're almost at the end of the presentation. I know it's 11:15. So for those of you that can hang with me, we only got a few more minutes, and then I will just start looking at the questions you've sent in and addressing those for anybody that can hang on, okay? So OSHA requirements. What do you have to do? You got to ensure that if you do have an infected employee, that they stay away from the workplace. You could isolate them if they let you know while they're at work. Get them home as soon as you can. You want to limit the spread through your proactive things you're already doing, like notices and disinfectants and hand sanitizers. Make sure those are available. I've heard stories of distilleries making hand sanitizer instead of booze, and that just kind of warms my heart. Contact the CDC for guidance, and remember that you need to record workplace illnesses if they were infected by a coworker at work. So some people have said, okay, how do we know that? Well, we're not going to know that for sure. But if someone claims they were infected by someone at work and it wasn't at home or something like that, you may be required to record it on your OSHA logs as an illness. That does not mean you have to report it to workers' comp. Reporting and recording are two different things. There are requirements for what needs to be recorded on OSHA logs if you are not exempt. Again, the list of companies who are exempt from these recording requirements are on the OSHA website. Reporting has to do more with, do you report a claim to your insurance company? And that's kind of up to you and your insurance company to decide when you do that, okay? If you have an employee who's infected at work and is hospitalized as an inpatient, or in the worst case scenario passes away, then you do have to report that to OSHA within 24 hours. You are not required to inspect people's home offices for OSHA compliance. So you don't have to visit everybody's house and make sure their home office is safe. Just encourage them to do so, and feel free to give them guidance. What about, is it a workers' comp claim? It is very unlikely that it's going to be a workers' comp claim because the employee would have to say they were infected by another employee at work. Now, if you have an employee who has it at work, and then you get 3 other people who work next to that employee and they all have it, then they may be able to say, I think I got it at work. But in most cases, because it's so widespread, and it can be passed, different ways all over the place, no matter where you are, it's very hard to say this started at work, which is usually what happens at workers' comp claims. All right, so for those of you who need to go and had a pretty tight deadline, close to 11:15, let's wrap this part up, and then I'll get to the other questions. We are going to continue to follow up with you. I know that hearing all this information has probably answered a lot of questions, but also generated new questions. And believe me, we're in the same boat. We are scrambling to get as much information as we can. We are passionate about helping you through this situation, just like we would on any other day. We're going to continue to present this information. You can download these slides. We will make this webinar recording available for free on our website, threadhcm.com, and go to the resource tab, and that's where our webinars are, our blog, and all other kinds of resources there. We are going to have a call with Greg Hare from Ogletree Deacons. Greg was recently the managing shareholder at Ogletree Deacons. He and I have worked together for years. He's a phenomenal employment lawyer, is very practical and smart, and works with a lot of businesses in a great way. And he's going to do a call with us this Tuesday, 24th at 11 o'clock Eastern time. Information will be going out for that as well, because we know after today and even over the weekend. There's always more news, more stories, more questions. And so we want to stay on top of this and make information available to you. So any questions you thought of that we don't get through today, we will make sure we pass along and try to hit those. If not today, then on that call. And then, like I said, visit our website, hit our YouTube page. We have videos out there. If you need a laugh, which some of us do, I got a series of sarcastic HR videos, just kind of poking fun at things I've seen, places I've worked and people I've worked with who kind of do what you should not do. And we've all seen that. And so I have a good time with that. We call our HR services here at Thread Engage. And we would love to support you with our HR services. It's geared toward businesses typically from 20 up to several hundred employees. And we want to help bolster your HR team, support your HR team, your office manager, your CFO, whoever's responsible for HR in any way that we can. And so we've built a pretty successful model to do that. And that's what we mean when we say, let Thread engage. If you see that on LinkedIn or a video or anywhere else, that's what that means. So please let Thread engage with you. And now I will look at some of these questions that are coming in there. I'm laughing just because there are so many of them. I'm not making light of it. Okay, here. Where do we find a definition for healthcare providers? That is not available yet, as far as I know. What about employees who are taking off if their spouse is sick, not necessarily from COVID-19? So yeah, if that would be under a different circumstance, right? So if they're home taking care of their spouse who is sick because of this issue, then all of that emergency stuff applies. If someone, just has a normal flu or cold or whatever, then you would treat that as a normal type circumstance. What leave do we have available, or what pay arrangements do we have available? Can anyone self-quarantine without seeking medical care and continue to get paid? That is questionable. I think under the emergency paid sick leave, it's if you have symptoms, if you're asked to self-quarantine. I think if you are self-quarantining because you have symptoms or think you're sick or something like that, then that falls under the emergency paid sick leave. I think if you just say, I just want to stay home and I'm not sick, that's not necessarily paid sick leave. That's just someone saying, I don't want to come to work because I'm not sure about that. And that's a different circumstance. Is this compensation taxable? Anytime you're paying employees, it's taxable, but that's why those tax credits are built into the plan to make sure the employers don't get hit too hard. It's supposed to reimburse them 100% through quarterly tax credits. Let's see. If they can work from home, would they still be eligible for the emergency FMLA? No, if they're working, they're not eligible for that. So remember, the emergency FMLA is only for people who cannot work because they're home to take care of kids who are under 18, because the kids are closed because of a public health emergency. It has to meet all those requirements for that to go in there, okay? How is variable comp handled? Commissions, bonuses, things like that. So I have seen some companies who say we're putting bonuses on hold, we're putting commissions on hold. Now, if you have employees who only work on commission, then you need to work out if they're able to work and earn commissions or not. You may have to punt if you need a different pay arrangement for them temporarily, or figure out, if they can work or not. And that's an issue you would discuss with your HR and legal as well. Scrolling. Can we waive requiring a note from a medical provider that quarantines or isolates the employee? So in other words, a medical provider says that the employee should quarantine or isolate, and someone's asking, could we ignore that? I do not recommend ignoring that, especially with what's going on in the world right now. I would say you should honor that and let people get healthy. It's a temporary thing. It won't last forever. One of the questions is, how will we process the tax credits? I know that it talks about going against your Social Security, your FICA, Social Security, and Medicare, and basically taking that off the top. So the amount of money that you paid required for the emergency paid sick leave or the FMLA expansion leave, that you would take those amounts subject to the caps off of what you would owe on your quarterly taxes. But you talk with your accountants on how you want to do that exactly and how that will play out in the future. Okay, here's a question. Typically, we require a fit for duty notice for employees to return to work. Can we ask someone who's on paid sick leave to present that on return? For the non-HR folks on the call, a fit for duty notice, some people call it a medical certification. All that is like a note from your doctor saying it's okay for you to return to work. It's safe for you to return to work. Under normal FMLA, outside of this situation, you can only require that fitness for duty return if you have given someone their job description at the beginning of leave. A lot of people miss that part. But under this situation, you could require a doctor's note to return to work. The CDC has recommended that you do not, for the reasons I described earlier, medical backlog, and et cetera. Okay, I'm just scrolling for another second and then we will wrap this up, okay? Do we file a workers' comp claim if it's a proven work-related illness, but how would you prove that? And then following that, would I record to OSHA, that kind of thing? So I think I answered that on the last slide before we wrapped up, which is good. Should we send a furlough letter regarding COVID-19 to those that we have already furloughed? I think that's up to you. The act and the requirements of the act start April 2nd. It was 15 days after the president signed it into law. Like I've said, so far, I have been told that it's not retroactive. A couple of people asked, so if we terminate or lay off employees today, are they eligible for this stuff? And so far, the answer I have is no. But after April 2nd, it would be yes. But we will continue to get clarification on that, specifically when we have our call with Greg from Ogletree Deacons. And also, I'd say you could look at the Ogletree Deacons website for an ongoing live update, just like other employment law firms has, to keep up with that. So I know there are more questions. I'm sorry we couldn't get to every single one of them. They're all good questions, legitimate questions. We will gather them, compile them, continue to share information relative to these questions, and then questions covered in our call with the attorney. And with that, I really appreciate your time. I wish you the best. Remember, be human beings, okay? Talk to people the way you would want to be talked to. Be practical, be flexible. Think about what's legal, but also what's best for your business, best for your employees. Take care of yourselves first so that you continue to take care of each other, okay? Talk to you soon.